To a CBS 11 exclusive, the director of Dallas County's Health and Human Services is speaking only to us about allegations of wrongdoing in his department. The state placed Dallas County Health and Human Services on probation last month. It is looking into whether employees entered false data into a state database that tracks HIV and STDs. Records show employees told investigators a supervisor had instructed them to falsify information in order to improve the agency's numbers. The county receives nearly $2 million from the state to control and prevent the spread of the diseases, but it is required to meet certain quotas. And now the Dallas County District Attorney has launched an investigation of its own. Dallas County Health and Human Services Director Zach Thompson joins us now from the Dallas newsroom. Mr. Thompson, thank you so much for making time for us today. We want to hear from you directly. Did your employees falsify data?
Well, what we're looking at is we're doing our own investigation. The OIG report identified that 3 employees did enter data. But the question is, there's 2 sides to every story. And one of the things we want to look at is to really verify in our own investigation what actually happened. To say that someone directed employees to enter data, that's the concern, because where is the conclusive evidence that someone actually directed a person to do that? The concern is you have 3 employees. One is a CDC employee. So I'm very concerned that a CDC employee would enter data under the direction or under the duress that he said or she said that they were told to enter the data. So we're doing our own investigation. The district attorney, I don't know exactly what investigation they are involved in, but we're doing our due diligence. What I want to remind Dallas County residents is that overall, we have over 450 employees who are doing a great job. This is an isolated incident. I removed everyone involved. All individuals who were implicated in this investigation have been removed out of that division, and we're starting anew, and I can guarantee you that this won't happen again. Isolated incident should not have happened, but we're going to make sure that we get all of the details as we move forward.
Mr. Thompson, give us some perspective in your department, in what you do every day. How and why did we get to this point?
Well, and that's the concern, is that there was no reason to falsify any data. If you don't make an indicator, there is not a consequence for not making the indicator. Other than you didn't make the indicator, you have another opportunity to improve. So I cannot fathom why anyone would want to create or falsify any data when there was no consequences from this aspect. One of the things we know from the OIG report that there was no compromise or breach of confidentiality of patient information. So at the end of the day, the question remains for the 3 employees, why, what was the motivation, but there was no pressure that I'm aware of that would require anyone to falsify information. I think we have to listen to every side of the perspective, but we definitely have taken swift action to remove those employees. And I think that's the key point, that this doesn't happen again. And I'm entrusting our staff who work day in and day out in terms of disease detection and public health follow-up. The overall commitment of that staff is in place, and they will work hard to make sure that this won't happen again.
So you have taken steps internally. As far as cooperating with the investigations, what have you done so far in your department?
Well, in terms of just the investigation, we've done our own investigation. In terms of the OIG investigation, we cooperated when they came and looked at the scenario, and we're very pleased that they did not find any compromising data being compromised on the relationship of the staff. But what we did was to make sure that we put employees in place that we won't have to revisit this scenario again. We're going to comply with the state mandate that they have given us, and that's where we're going to be doing ethics training, HIPAA training. We're going to be doing a comprehensive aspect in ensuring that employees understand the importance of protecting the integrity of the division, of Dallas County residents, trusting them, and we're going to move forward from this. And again, I guarantee the Dallas County residents that we will not have this again.
Okay. Dr. Zach Thompson, thank you very much. Dallas County Health and Human Services Director, appreciate you speaking with us here at CBS 11 today.
No, thank you.